having us.
So I'm talking about medical freedom today. And I have some disclosures to make. For one, I am not anti-medicine. I'm not anti-vaccine. I'm not anti-physician. And I'm not anti-science. As a matter of fact, I've been in the medical field for 38 years. I am a scientific person. I was a perfusionist, so I operated the heart-lung machine during heart surgery for 20 years. I've had every vaccine to be able to work in the medical field. And I've worked with some of the greatest cardiac surgeons in the world. So I am not anti-medicine. But what's happened to medicine, which has been happening for a while, but it was really magnified during COVID, has made me really question, where is the medical field going? I'd like to start with a story. This is a true story, okay? And this story started around December 2020. So we're in the midst of COVID, and there were a number of physicians worldwide, around 6,000 physicians worldwide. They were in contact with each other via networks. What are you doing? What are you seeing with COVID? Trying to identify, this was a novel coronavirus, right? A new coronavirus. What are you seeing? Is anything working? What are you trying? This is Dr. Pierre Kory. Has any of you have heard of Pierre Kory? Okay. Dr. Pierre Kory is a highly renowned medical intensivist. That means that he specializes in taking care of critical care patients. And he had started, and his group had started looking at, okay, what do we know about the virus? What are we seeing with what this virus is doing? Are there repurposed drugs that we can use that could potentially help patients? And he had a large series of patients. He also did a meta-analysis. Everyone familiar with what a meta-analysis is? So a meta-analysis is you look at all the evidence that's in the scientific literature. Now, there's a lot of evidence in the scientific literature, and in the literature we classify basically the priority of that and how good that evidence is by 4 classifications. Class 1A is the highest classification. It is the highest scientific evidence that modality is working. All the way to class 4, which means that there's no scientific evidence that it works. Look, and a meta-analysis is looking at all of those papers and grading those papers, the power of those papers, depending on how many patients are in it, the methodology of those papers, and then coming up with, okay, what is the scientific evidence for this modality? Kory testified in front of the Senate, and you can find this on YouTube. He was very passionate that ivermectin was very effective in the treatment, early treatment, prophylaxis treatment, and late treatment. Now, granted, the scientific evidence he said would show is that late treatment, if they're in critical condition, the effectiveness of preventing mortality dropped to about 65%, but it was as high as 87% reduction in mortality with ivermectin. He was very excited about this as an intensivist. This is something that we can, this novel coronavirus where people were dying, that this could save lives. So he testified in front of the Senate in December of 2020. So just a couple weeks after that, he testified in front of the National Institute of Health, and along with him was Dr. Paul Marik. Now, Dr. Paul Marik is the preeminent expert on sepsis in critical care medicine. He's had over 600 published articles. There is no one smarter in the world than Dr. Paul Merrick on sepsis. I point that out because he's no lightweight, okay? This is Dr. Andrew Hill. He's a physician and was a consultant for the WHO. He's also a consultant for the NIH, and he works in Edinburgh University in England. These three people, at this time, prior to Pierre Corey's testimony, supported the use of ivermectin. And they were very excited to get it out there that the NIH and the CDC support and get the word out to physicians, not only in the United States, but worldwide, about the effectiveness of ivermectin. So this is the January 6th meeting, treatment guidelines panel. It changed because of their testimony. It changed their previously negative recommendations to doctors on the use of ivermectin to neither for or against. Now, this was very disappointing for Dr. Merrick and Dr. Pierre Corey, because their systematic review meta-analysis said this could save lives. Even Dr. Andrew Hill, and you'll hear him a little bit later, even he said that potentially this could reduce the morbidity and mortality of ivermectin by 85%. So how many people died in the United States of coronavirus? Around 6 million. You do the numbers, 85% reduction in that number, right? So even though it was a neither for or against, they were hoping that the NIH would say, go for it, let's make this available. This non-recommendation was the first obvious signal of the agency's determination to suppress the use of ivermectin. NIH claimed that there was, quote, insufficient evidence to recommend neither for or against the use of ivermectin for the treatment of COVID-19. Now, are any of you familiar with forest plots? You are familiar with forest plots? Okay, so forest plots basically, so if you see over here, see this line here? And so this is what a systematic review meta-analysis is. And what they're looking at is they're looking at all these papers, and anything to the right of this line shows that it is a positive for the use of ivermectin. Anything for the left of the line means that it shows that it's either if it's further away from the line, it's not effective at all. And you can see that there was one paper that was to the left of the line. All of these were to the right of the line, and the larger that these squares are, the greater the statistical significance. Okay? And it showed, and this is just a graph of early treatment with ivermectin. And these are all the papers, and 84% improvement with early treatment. This is a study of 48 ivermectin papers. You can see that you've got one study down here that's to the left, meaning that it was not effective. You have all these studies. See how far to the right these are? How far to the right? And how large those boxes are. See how tiny that box is? Well, it's large to the right, but this was probably a smaller study. But all these large boxes, 73% improvement.
Oh,
yeah.
That second one from the bottom, it's got 600% there on improvement.
Where?
At the very bottom, and that, yeah, no. Right there, yeah, Bronfe. There.
Yeah, so one of the other things you have to take into account is his confidence interval here. And so you can see that this showed that this is one of those studies that was to the right. So it showed that study was not an effective study. Those patients did not respond to ivermectin. But the other problem that you have to look at this is that you have to look at this confidence interval here, and won't get into the statistics of it, but if you've got a very wide confidence interval, that's not good, okay? So that was one of those studies that was not effective for ivermectin. But a systematic review meta-analysis looks at the preponderance of the evidence, okay? And so the preponderance of the evidence with these studies was, like I said, I look at these, and I think that that's why Pierre Corey and Paul Merrick, why they were like, what do you mean you have neither positive or negative? You should be saying yes. January 4th. Originally, Dr. Andrew Hill was at the the December 2020 Senate hearing where Pierre Corey spoke to the senators about the effectiveness and was supportive of ivermectin. The meeting at the NIH was supportive of ivermectin. But there was something going on behind the scenes. You see, because he works for NIH and consults with the World Health Organization, he was asked to do his own meta-analysis, systematic review. The end of December 2020, another person comes in into play here, and I'm going to need to bring up my
the one thing that none of them actually worked in the field though. So it's when you work with these people every day, hours and hours on end, none of these people did. Even people that were pro-ivermectin, anti-ivermectin, they didn't have any weight, regardless, in my opinion, because they weren't doing bedside work.
So Pierre Corey and Paul Merrick are intensivists, so they were working in the intensive care unit. Yeah.
I guess it's all done. When they're tubed, they're dead.
Yeah.
I mean, they're dead. That's their deathbed. I mean,
Which is why early treatment was so important, because if you get to the point of getting to the hospital, 50% mortality rate for the hospital. If you go to the intensive care unit, 94% mortality rate.
As soon as you tube them, you tell the family, go ahead.
Yeah.
Call your family in.
When did Joseph McCullough get involved? Because I heard
he was involved early on also.
Right.
He had a little bit of a early treatment, different treatment protocol than the FLCCC.
Of their studies,
but he was positive for ivermectin. He also was very positive for anti-inflammatories, budesonide, so on and so forth. And by the way, we may get Peter McCullough here next year.
Whoa.
Yeah. So at the end of December 2020, Tess Laurie comes into the picture. Now Tess Laurie, she is the head of called a Cochrane Collaboration Group. Cochrane Collaboration Group is a group of experts in whatever field. In this case, it would be epidemiology, virology, so on and so forth. And you bring this group together, and they are the ones that do the meta-analysis. And so what her company does, and she actually used to consult for the WHO, and she works over in England. And so over Christmas, she heard Pierre Corey's testimony at the Senate, and she says, you know what? I heard what he said. I'm going to do my own meta-analysis. She did her own meta-analysis. She published that meta-analysis. And she was so excited about it, she contacted the British Minister of Health and said, you have to look at this meta-analysis of mine. We need to get this drug out there. So she, on January 13th, she used her influence to assemble, by invitation only, a symposium of 20 of the world's leading experts to review her meta-analysis. Again, this is what you do in science, right? Okay, I did my thing. This is what I believe. This is my evaluation of the data. But you know what? I'm not going to trust. I want to bet this again. So she said that to do this review of the meta-analysis and make an evidence-based recommendation on ivermectin. This type of analysis, like I said, is called a Cochrane analysis. And so Dr. Laurie invited Dr. Andrew Hill, who changed his mind because he originally supported it, and then he came out with his own paper and said, yes, it is, this is positive, but we don't have enough scientific evidence yet to make an evaluation and to make a positive evaluation for ivermectin. So Dr. Lori invited Dr. Hill to the symposium and offered to co-author the paper that she ultimately published, but he declined. Now she videotaped or audio taped her conversation with him when he declined. She said, Lori, who is trying to influence you? Dr. Hill said, I mean, I think I'm in a very sensitive position. Dr. Lori, lots of people are in sensitive positions. They're in the hospital, they're in the ICUs, they're dying, and they need this medication. Well, this is what I don't get. You know, because you're not a clinician, and you were right in this case, Dr. Hill is not a clinician. You're not seeing people dying every day, and this medicine prevents deaths by 80%. So 80% of those people who are dying today don't need to die because there's ivermectin. There's a lot, as I said, there's a lot of different opinions about this. As I say, some people simply, we are looking at the data. It doesn't matter what other people say. We are the ones who are tasked with looking at the data and reassuring everyone that this cheap and effective treatment will save lives. It's clear. You don't have to say, well, so and so says this and so says that. It's absolutely crystal clear. We can save lives today if we can get the government to buy ivermectin. Dr. Hill, well, I don't think it's as simple as that because you've got trials. It is as simple as that. We don't have to wait for studies. We have enough evidence now that shows that ivermectin saves lives. It prevents hospitalizations. It saves the clinical staff from going to work every day and being exposed. And frankly, I'm shocked at how you are not taking responsibility for this decision. And you still haven't told me who is influencing you. Who is giving you that opinion? Because you keep saying you're in a sensitive position. I appreciate you're in a sensitive position. If you're being paid for something and you're being told to support a certain narrative, that is a sensitive position. So then you kind of have to decide, well, do I take this payment because in actual fact you can see your false conclusions? Are you going to harm people? So maybe you need to say, I'm not going to be paid for this. I can see the evidence and I will join the Cochrane team as a volunteer, like everyone on the Cochrane team is a volunteer. She goes on, but Andy, know this will come out. It will come out that there were all these barriers to the truth being told to the public and to the evidence being presented. So please, this is your opportunity to just acknowledge the truth in your review, change your conclusions, and come on board with the Cochrane review, which will be definitive. It will be the review that shows the evidence and gives the proof. This was the consensus on the Wednesday night's meeting with 20 experts. Dr. Hill says NIH will not agree to recommend ivermectin. Yeah, because the NIH is owned by the vaccine lobby. 4 days before Hill's meta-analysis study was published, Hill's employer, the University of Liverpool, received $40 million from Unitaid. 3 of the 9 members of the NIH panel had disclosed financial relationships with Merck. Now, why is this key? Because Merck later came out with a medicine that did one thing that ivermectin did. Ivermectin has about 20 different mechanisms of action. The drug that Merck came out with did one of those things. One of the 9 members of the NIH panel received a $155 million grant from NIH to further the studies of ivermectin. That study was the Together study. That study came out and just happened to, so if I were to ask you, do you think it supported ivermectin as being a good drug to use, or it didn't?
No.
It did not.
That's what they're paying.
There were so many, and you can read that study. Read the study. And you can look on the internet on the commentary on that. People were saying, I mean, it was so convoluted. It was a terrible study. And so physicians and scientists were saying, can you give us the raw data? Now, anytime that someone asks for the raw data, that means they're concerned with some of the statistical methods that were used. They're concerned with the methodology of the study, and before they can make a final, a final decision on this, they have to look at the raw data. The raw data was never provided. This is just one example. So this is deaths from Alzheimer's plotted against glyphosate and statin use. So glyphosate in blue, statin use in yellow, and Alzheimer's.
What's on the x-axis?
So these are years,
Time, okay.
okay? And so what does this show you? Well,
They're all killing people.
glyphosate, that's pretty bad, right? That's in stuff that's in Roundup.
Yeah.
So who creates Alzheimer's at a higher rate? Statin drugs or glyphosates? Statin drugs.
It's the statin, the warfarin,
And yet,
the lectin.
that is one of the most popular drugs out there as far as Alzheimer's.
Because everyone's
So, what is the problem? The problem, this is problem number one, is that big pharma is in control of medicine. This is, and I'm just to prove you, the Science magazine, so very reputable. Hidden conflicts. Pharma payments to FDA advisors after drug approvals spark ethical concerns, and this was in 2022. Biopharmaceutical industry provides 75% of the FDA's drug review budget. So the equivalent to that would be, I've got 14 chickens out here, and instead of having a dog that keeps away the predators, I actually invite the fox in and the raccoons to guard my chicken coop. Is this a conflict of interest? Is this clear?
It's clear. It's in your face. Well, it's in your face when you're working it. I was almost done with my master's in nursing, and I quit like in 2021. I just couldn't do it.
Yeah.
Yeah.
Institutional corruption, big pharma, money permeating global drug relations.
Well, they have incentivized the doctors to push the vaccines.
well,
I
yeah,
mean, they get
you-
their
you
bonuses, hundreds of thousands
Oh
of
my
dollars
God!
a year.
The car crashes. Did you hear them cough? COVID. You know, heart attacks.
Yeah.
You're doing it. Oh, are they
Gunshot
COVID positive?
wound.
Gotta wait. Gunshot wounds.
To the head.
They cough. They were coughing.
Yeah.
COVID. 10,000 each.
Hidden conflicts, pharma payment to FDA advisors after drug approval spark ethical concerns. So big pharma, number one issue for medical freedom in the United States. Number two, the loss of private practice physicians. 74% of the physicians in this country are hired by a hospital group. All right. This came about as a result of the Affordable Care Act, Obamacare. Doc blames Affordable Care Act for the death of private practice. One of the reasons why is a part of the Obamacare Act was, I think it was a good idea, electronic charting, but the requirements, and if my wife was here, because she's a mid-level practitioner, and she's also a professor of nursing, when Obamacare, and she was a midwife working in a midwifery practice, and it was amazing how long it took her to fill out an intake. And it took that time away from actual face-to-face patient care, filling out all these questions.
Started sucking really.
Feeling the pain, huh?
Yes, immediately. Yes.
Why do they still ask the same questions though? If it's digital stuff, I mean, you go in and
Well, there's
they're still
different.
asking the same stuff when they see it right in
Yeah.
front of you.
And
Well,
there were-
it doesn't talk.
Yeah, they don't talk.
There's the whole
There's
point of
like
digital, but
hundreds
that
and
was the
hundreds of
guides.
different. Yes.
Yeah.
The
That was
goal,
the guide.
the goal of
Just to get
bureaucracy
everything
is to
uploaded and
increase
Get
bureaucracy.
our
Yeah.
information.
So again, I'm just showing you some articles out there. This is an excellent Substack, and this is what this guy writes. This is a letter he wrote. He goes, dear Steve, you asked why doctors are silent. And now this is one of the things. This is one of the things that you got. And as much as I can rail against how doctors have just closed their eyes to hearing and actually following science, but why are they doing that? That's the question. But I want you to ask yourself, if you were in their position, what would you do? So you ask doctors, why are they silent? And this is in regards to, why are they silent about not giving informed consent for vaccines? It is clear scientifically now that these vaccines are not what they were promised, and that, and if you want to talk offline, I can talk to you about some data that's come out, because the CDC does not give us data. It's just crap. But over in Britain, there is actually some data, and there is literally no risk benefit now for giving vaccines. And the British National Institute of Health, they have that data now. So I can talk to you about it later if you want. But he writes, the electronic medical records are a ball and chain to physicians. We are tracked through them. When I wrote a prescription for ivermectin for a patient with informed consent, she was vaccinated, I received 5 letters threatening my medical license, my hospital privileges, and my insurance contracts. I would not have received 5 letters if I had killed someone in negligence or malpractice. If I have my license pulled, I will no longer be able to help my patients. So there are doctors out there that are ethical. They want to do the right thing, but it would mean losing their profession.
My best friend was killed in Florida. He got COVID, ended up in the hospital. He took some ivermectin a couple days before going in. He started feeling better. He called me. He's like, you got to get some of this. The CEO of that hospital told all the physicians that they prescribed ivermectin to anyone in the hospital, they would lose all their hospital privileges. He died because he couldn't get any more.
He said, I speak to patients on a one-to-one basis, but speaking out would destroy my family. Would you do the same for your family? Yeah, you would. You would. I have children. Quite frankly, I have seen that patients want me to risk myself for them, but are wholly unwilling to support their physicians. The population is lazy.
Amen.
So, that's where we're getting into the next. So he goes on, he says, I can save your life, but I get paid less from my work than some hairdressers. That's because the hours that he puts in. My education is not valued by society as supported by the rise of the advanced practitioner provider. I am almost done with my profession. I hope to retire in the next 1 to 3 years, decades before I plan. I love what I do, but cannot take this toxic and broken system any longer. And this is why so many have retired in the past couple of years, and this trend will continue. Also, the suicide rate is very high. Lastly, I'm attaching the latest California bill to throttle physicians. Have you heard of this California bill? So this California bill is a bill that says that if you as a physician are spreading misinformation, as defined by whom? The California Board of Medical Licensing. They're the arbitrator of the truth. You lose your license. I hear no outcry. I told patients over a year ago that the vax would not prevent them from getting COVID. Why did he know that? Because it was in the Pfizer documents. It was in the Pfizer documents that clearly said, we didn't test transmission. We didn't test it.
I mean, it's just like the flu shot. You still get the flu.
Yeah.
You know, you still get the flu because it's a guesstimate. But this is not even a guesstimate.
Yeah.
This is just a
Shit show.
Yeah. It was never studied to do so. I actually read the studies. This course was disinformation, but has now been proven to be true.
So as of right now, it's still just a bill?
Is it what?
As of right now, is it still just a bill?
It was passed in California, but it's now in litigation. But it was passed, yeah. Who will be the truth czar for healthcare? How am I to keep up? Am I left to assume that the population wants the government to guide their healthcare? In general, I would answer that to be yes, in general. Now, I hear some no's. That's good. That's good. But in general, the population wants the government to do everything for them. I am left to assume that is, in fact, the plan. The healthcare system will be socialized within the next 5 years, I predict, and the population will be shocked. No one is paying attention. I thank you all for all you're doing and wish you the best of luck. I feel you are Davids against Goliaths. This is just one physician, but I can tell you, this is how a lot of them feel. So, how do we go forward as far as having medical freedom? Now, how many of you have heard of shared decision making? Okay? This is a relatively new concept in medicine. So, SHARE stands for Seek Your Patient's Participation. This is what doctors should be doing. And the reason why I wanted to give this is I wanted to educate you on shared decision making, because these are the questions that we should be asking our doctors now. So, seek your patient's participation. What would that look like?
Accountability.
A what?
Accountability.
Accountability? Yep.
Could you kick them to the curb if they don't?
Yep. What else?
Responsibility.
Responsibility. For example, I got a... very quickly, my wife and I treated over 300 people in this county with ivermectin. My wife being a mid-level practitioner, she can prescribe, and we prescribed ivermectin, well, initially hydroxychloroquine, but we've prescribed ivermectin. We did kind of a telehealth thing with people, and we had over 300 people. Our little observational study, 0 went in the hospital. And we had some sick people. We had people that normally responded in 5 days, but we had some people that took 2 weeks of ivermectin, antibiotics. We would prescribe other things for them. And they were fearful. They were fearful. And so seeking the participation is, what do you want? You've got high blood pressure. I can give you these medications. And what if your patient says, I don't want to take high blood pressure medication? Well, physicians will say, well, you have to take blood pressure medication. You know, your blood pressure is going to kill you. And that's true. It potentially, you know, if it gets high and whatever, you know. But it is seeking their participation too. Is there a way around, doc, that I can not, because, you know, I had a relative who took a high blood pressure and it really made him feel like crap, and I don't want to feel like that way. I don't want to feel that way. Seeking the participation. Help your patient explore and compare treatment options. Now, my wife, who's a professor, and she teaches nurses that are getting their master's degree and their doctorate degree. This is a thing because in medicine, we're used to saying, listen, are you a medical expert? So I'm saying that you need to take blood pressure medication, and you're like, is there another way? And some of these nurses, it's kind of a foreign thing to say, what if you don't take my best advice? Do we just stop the conversation there? Or do I try to work with the patient on other ways that I can mitigate their blood pressure situation? Assess your patient's values and preferences. Yes.
So the flip side of all this, and it gets back to individual responsibility. Okay, the doctor doesn't have to agree with his patient's assessment. Okay, say no, I can't recommend this. You know, the patient doesn't have the right after that to claim malpractice from the doctor.
I would agree. Yeah.
You have to be responsible for yourself. The doctor has to be responsible for himself. And if you can't come to an agreement, then you go your separate ways.
Yeah. Yeah. And you kind of, one of my endpoints is we need to take responsibility of our own health care. Now, we are not experts in medicine, you know, but we still need to take responsibility of our own health care. But the doctor needs to be willing to assess the patient's values and needs and preferences. How many of you like natural healing remedies? Then a doctor should take that into account. And I'll talk to you about what kind of doctor that is here in a second. with these three, reach a decision with your patient. Instead of the doctor telling you this is what's going to do, it is a collaborative, it's shared decision making. Yes.
So you may get to it. Maybe you're going to get to it in the R. Would you say, like, in 2 months, come back to me? If you're down 10 pounds, we'll reevaluate the need for the medicine, kind of thing?
Yeah, exactly.
Okay.
Yeah, exactly. Evaluate your patient's decisions. And this is integrative medicine. Okay, so shared decision making is a portion of integrative medicine. And this is a relatively new concept. So integrative medicine uses an evidence-based approach. It's not non-scientific, to treat the whole person. Your mind, your body, and your soul. Your physical, emotional, mental, and spiritual needs are all involved. So integrative medicine uses a combination of therapies. It integrates conventional approaches and complementary therapies to achieve optimal health and healing. So, what are some of these complementary medicines? Acupuncture, animal-assisted therapy, aromatherapy, dietary and herbal supplements, massage therapy, music therapy, prayer and meditation, resilience training.
Kind of
How
before
many-
Rockefeller took over.
Well,
Yeah.
there you go. And I don't have time to go into what happened when the Rockefellers took over, but medicine was a lot like this prior. Yeah.
So I'm director of the Job Corps now, and I get to do this with the students. And so we have a formal, like, okay, you're going to do this, you're going to go to therapy, we'll have the diet plan for you, we'll have the workouts for you every day. And then if they don't follow through, then we get them off. And then now they're like a behavioral issue for not doing stuff like that. So we get, it's not but like you said, you worry about like malpractice and stuff, because initially if they don't, you're like, oh, he's mean to me. He's like, no, you chose this, buddy.
Yeah.
Yeah.
Well,
Yeah.
By the same token, you know, you can't, you shouldn't institute things that tell people what they have to do. Okay?
Well, they can't complete their job if they're. It's a job. It's a job.
I understand. But we have to work those issues.
Which is what I'm doing.
You know, you can't.
I'm going to tell them what I'm going to do
We
because
can't
I'm
keep
the director.
fostering systems where somebody is charged with telling other people what to do.
Yeah. Yeah.
I work with sick and dying people 40 hours a week, and across the state. A lot of them can't get doctors, and it doesn't matter if it's mental health or physical health. I don't really know the reason why, but I know it's pretty extraordinary. Is it because they're all demoralized because of what you're talking about?
Oh, it could be. It could be.
They're-
A prime example of this is all the major diseases that we have that are the top three: cancers, heart disease, strokes. All those are diseases of inflammation, right? What is the root cause of the inflammation in your life?
Diet.
Is it because you're overweight? Is it because you are? Is it because of your diet? Is it because of your stress? Is it because your husband is? You're living in domestic abuse every day. An integrative medicine specialist will take all these into account, not just throw a pill at you, because that's what we do now. We throw a pill at you,
That's how they're trained.
and we're all willing to accept that pill, and we shouldn't be, because we need to take this integrative approach to a disease process. Complementary medicines, evidence-based, okay, relieves pain. Pain causes inflammation. Reduces anxiety and stress. Anxiety and stress causes inflammation. Reduces nausea, improves mood, increases relaxation, brings down the blood pressure, improves wound healing, encourages feeling of well-being, pleasure, positivity, and inner peace, relieves muscle tension, decreases tiredness, improves flexibility and circulation. this is what you take control of your own health care. If you have someone in your life that is a medical person and you can bounce questions off of them, bounce questions, but we need to ask questions. We need to ask the questions of our doctor. I can tell you that when I got COVID, I didn't take my own advice. I didn't think I had COVID. My wife said, you want to start? I had a low-grade fever. And I was actually progressed. I was 6 days. I was the Delta variant, so the worst variant. And 6 days, I was on 5 liters of oxygen. I had bilateral ground glass in my upper apices. I had atelectasis. My lungs and my bases were collapsed. And, but we literally had a little intensive care unit going on in our house there. I had an IVM, I did vitamin C, ivermectin, fluvoxamine, we did everything. I came through and I'm completely normal, no loss of exercise capacity at all. When I went to my doctor to get a follow-up, my D-dimer, by the way, my D-dimer level was at a level where I had a 94% mortality rate. That's how high my D-dimer is. And they thought, that I might have a pulmonary embolus. But when I went to my doctor and I said, do you believe in early treatment for, I was just asking, believe in early treatment for COVID? No, there's no treatment for COVID. She's not my doctor anymore.
Yeah.
And ask questions. Take control of your own health care. Find a physician and ask the questions. Look up shared decision making, or I'll give you this presentation. Look up shared decision making. There's tons of information on it. Look up integrative medicine. There's tons of information, and find yourself a good integrative doctor.
Functional practitioner.
Or a practitioner, yeah.
Functional.
Yeah.
We're farmers, and we do field trials, and Monsanto had come, and they were telling us that glyphosate was just fine for the humans. It kills plants by the Shemika pathway, and humans don't have a Shemika pathway, so glyphosate there's no health issues with humans. And shortly after that, I was diagnosed with an autoimmune, and the doctor wanted to give me a steroid, and that would be a permanent pill. And I said, no, I don't want to take that. I know people who take it and they've got mental issues now. And he said, well, that's the protocol. And he got very angry at me for pushing back at it. And I said, well, I'm not taking it. I want to understand what caused me to get this and undo it. And he looked at me in the face and just said, this is the protocol and you'll follow the protocol. And I got up and I walked out, and this was about 15 years ago. And I got on the computer and I kept researching. I have no science or medical background. And somebody I found and this was like before there was anything about the gut, they had found that the Shemika pathway is in humans, and it's in the gut. And that is why this glyphosate is having a profound effect, and it's killing the gut bacteria, and people are getting all these autoimmune issues. And if I hadn't have found that little piece of information and then started getting glyphosate out of my body and doing all the things you need to do, I'd be dead by now, but they're insistent following the protocols that are being handed down to them.
And those are being handed down by the hospital systems, and they have to follow those protocols. They cannot deviate from those protocols. If they deviate from those protocols, then you will be called in, and you could, potentially lose your right to practice, or, as the one physician said, your ability to
help your patients.
to bill insurance companies and so on and so forth. And this is a prime example of what I'm talking about. Not a medical person. You're not a scientist. You're a farmer. You know a lot about farming, but she took control of her health care. And my wife was diagnosed in June of 2020 with a stage 3 colorectal cancer. They thought it was a stage 4. Luckily, it was a stage 3. And she, cancer, this is I can read research papers, but the cancer nomenclature is foreign to me. It's like speaking, German. And we had to read papers over and over again, like 3 or 4 times we'd read this paper. And she decided that she was going to take the chemoradiation, even though she didn't want to, but she's going to take the chemoradiation because we hired an integrative oncologist. the integrative oncologist said, your cancer is so advanced that I think that you need to like get ahead of it and use supplements. But by the way, he was not a practicing oncologist. All he did was consult. Why did he consult? Because oncologist is the only discipline in medicine that is not allowed to use off-label drugs. They are not allowed to use off-label drugs. So he shows that there's clearly a lot of evidence on use of off-label drugs for the treatment of certain types of cancers, but he can't prescribe that because he'd lose his license. So what he does, he says, I'm not practicing, I'm consulting. He just happened to be, when he was practicing, he was one of the top 5 oncologists in the United States. He's an integrative oncologist. And that's who we recommend. Anyone that we know that gets cancer, we say, listen, your decision, again, shared decision making. You are the patient. It's your decision, the course of action. If you say, you know what, I've got a cancer that might be fully treated, but I don't want to go through that. I don't want to do that. Your physician shouldn't say, well, that's the protocol. Your physician should say, I'm going to support you on that. How can I support you on that? And my wife wanted to take this called watch and wait, where the basic, they want to do the 6 weeks of radiation chemotherapy. Then they wanted her to wait 6 months, and then she was going to do surgery to take the tumor out, have an ileostomy, and then wait another 6 weeks, reattach everything together. She didn't want to do that. She wanted to watch and wait. We did the research on it. There were some patients that would watch and wait, and using the off-label medications, the tumor went away without having to have additional chemoradiation. And she actually, by doing watch and wait for 20 weeks, doing watch and wait, she had the greatest reduction in her tumor size during that 20-week period, greater than what the chemoradiation did. Then she had the surgery, and the surgery was more successful. She doesn't have nearly as many side effects from her surgery. And her integrative oncologist said, yes, that is an acceptable thing to do. You know what? It is. You're not going to harm yourself. Your tumor is either going to continue to shrink, or it's going to probably stay about the same. But evaluate it after 20 weeks, get an MRI, and check things out, and go from there. That is what an integrative specialist is about, and that's really what I wanted to show you. Our healthcare system is powered by big pharma. It's powered by big hospital systems where physicians cannot treat patients like they want to. There's a protocol. We have to follow this. So we have to take control of our own healthcare, and shared decision making and integrated medicine, I think, is the best way to go.
To be aware of new videos like this one, be sure to subscribe to the Preparing for the Time of Trouble channel. For more free videos and downloadable audio podcasts, as well as handouts, go to www.preparingforthetimeoftrouble.com. Topic categories include recordings of live seminar presentations, country living, sustainable gardening, homestead remedies, how to be self-sufficient when the grid goes down, wild edible and medicinal plants, hydrotherapy, and end-time Bible prophecies. To take advantage of these free resources, go to preparingforthetimeoftrouble.com.